Everybody's asking me, when is an AI gonna replace you, doc? Like, what's the status of AI in dentistry or in healthcare in general? Well, today I'm gonna put 4 of these AI engines to the test, and we're gonna see which one would make the best dentist. Let's get into it. So I'm gonna be comparing ChatGPT, Grok 3, Meta AI, and Gemini. So for the first question, I wanna see if I can kind of trip up the AI. The question is, a patient has a large cavity that is close to the nerve. Do you jump straight into doing a root canal or do you attempt a pulp cap? So essentially when you get a cavity in your tooth, it's like a big hole that gets in your tooth with some bacteria that are just eating away, getting closer to the nerve inside of your tooth. When that bacteria get inside of that nerve, that's when you need a root canal, where you basically remove the entire nerve, clean out the tooth so it doesn't get an infection. But if it doesn't get fully into that nerve, then it's kind of dicey. Sometimes you might need a root canal, sometimes you don't. This is where I would love to see the AI ask some follow-up questions. Instead of just jumping straight into an answer, possibly doing a series of tests to determine the symptoms. Also, they should be asking to look at x-rays. This can help show if there's an infection or something else going on. All right, ChatGPT said, 1, is the pulp exposed? If no pulp exposure, if the decay is very close but not yet into the pulp, an indirect pulp cap is preferred. If yes, there's a pulp exposure, a direct pulp cap can be considered only if the exposure is small, it's mechanical or traumatic, not from caries like a cavity or something like that. The pulp has to be asymptomatic or mildly symptomatic, and there has to be no lingering pain to cold, no spontaneous pain, and a normal x-ray. So I think this answer is close. It's generally good, but the pain, the symptoms still matter even if it's not into the pulp. It said if there's no pulp exposure, meaning you're not into the nerve, then you don't do a root canal. You just do what's called an indirect pulp cap, which is basically where you put some medicine over the nerve and then you do a filling. But that's not always true. It really depends on the patient's symptoms. But here it really said the symptoms only matter when there is an actual exposure, when you actually get into the nerve inside of the tooth. That's like telling a patient, hey, I know you're in a ton of pain, but ChatGPT said you don't need a root canal, so we're just gonna leave it alone. It did also say that the age of the patient matters. So in younger patients, it's better to try more conservative options, like a pulp cap, like something like we were talking about. Whereas in older patients, the pulp or the nerve doesn't really heal as well. So it might be better to jump to a root canal earlier on. I actually agree with that. All right, let's see what Meta says. In cases where a cavity is close to the nerve, the approach often involves trying to preserve the vitality of the pulp if possible. Basically, trying to prevent a root canal if possible. It depends on several factors: the extent of the decay, symptoms, and the health of the nerve. Pretty true. Given these considerations, a dentist might first attempt to remove the decay and assess the pulp's condition before deciding on a treatment plan. Honestly, that was pretty accurate. It was pretty short and to the point, but essentially that's what you do. You remove the decay and then you kind of see how deep it is. But it didn't really go into detail on the specific symptoms you look out for. It didn't really go into x-rays or anything like that. So let's see what Grok has to say. Pulp cap, indications. A pulp cap is typically considered when the cavity is deep, but the pulp exposure is small or not exposed, and the tooth is asymptomatic or has mild symptoms. And it specifically said sensitivity to cold that subsides quickly. That's actually called reversible pulpitis, meaning your nerve is inflamed, it's angry, but it's reversible and it should heal on its own. Whereas if you have some cold sensitivity, like your tooth is sensitive to cold but it's lingering for like a minute or two and it's not going away, that's actually called irreversible pulpitis. And that's an indication that you need a root canal because that nerve will not heal on its own. A root canal is recommended if the cavity has caused irreversible pulpitis, true, or pulpal necrosis or an infection. Large cavities very close to the nerve with symptoms or radiographic evidence, like basically taking an x-ray and you see something, often require a root canal. General approach, if the tooth has no symptoms, the pulp is vital, meaning the tooth is alive, and there's no or minimal exposure, you can do that pulp cap basically to prevent a root canal with close monitoring. But if there's significant pulp exposure or you have those symptoms of irreversible pulpitis we talked about, or an infection like you see on an x-ray, or if you have an abscess, then a root canal is safer and more predictable. I love that answer. That was great. Nice job, Grok. All right, Gemini. When a patient has a large cavity close to the nerve, the decision to attempt a pulp cap or straight to a root canal depends on several crucial factors. Primarily the health and vitality of the pulp, or the nerve and blood vessels inside of the tooth. When pulp capping is considered, no signs of that irreversible pulpitis, minimal or no pulp exposure, healthy pulp, no signs of infection. Patient factors. Younger patients tend to have higher success rates. When a root canal is likely needed, if you have irreversible pulpitis, pulpal necrosis, meaning your nerve has died, or if you have signs of an infection, or if you have an extensive exposure, like when you're removing that cavity, or if you have uncontrolled bleeding. Interesting. So I'm gonna give that one to Grok. I think it had the best summary. It went into detail in the right spots, so point to Grok there. Now let's ask these AIs as if I was a patient, not an actual dentist. I'm gonna pretend like I was a patient that didn't feel like going to the dentist. 6 months ago at the dentist, I had no problems and no cavities. Today, I woke up in the morning and my tooth on the lower right started hurting a lot, and I have a headache. It hurts every time I eat anything. What could it be? All right, let's start with Meta. That sounds painful and frustrating. Thank you, it is. Especially since you didn't have any issues previously. Here are some possible causes. 1, tooth decay. 2, tooth sensitivity. This could be from receding gums, worn enamel, or gum disease. 3, a cracked tooth. This is what I think is a little bit more likely. 4, a dental abscess or infection. 5, gum disease. 6, dental trauma, if you recently hit or bit your tooth. 7, food particles or debris. Sometimes food can get stuck and cause pain. Wow, it didn't mention the number one thing I was thinking. Grinding your teeth. This is probably the most common cause of symptoms like this. If you're waking up with a headache and pain, and this pain is in the morning, if you've been grinding or clenching your teeth all night long, which some people do when they're stressed out, or if they have different sleeping conditions, then it can cause your teeth to hurt, especially in one spot if you've been putting more pressure on it. I did like how it mentioned a cracked tooth, because grinding your teeth can lead to a cracked tooth, and those lower molars are the most common teeth to crack. But a lot of the other stuff isn't really likely. It's still possible, but not really likely if you just went 6 months ago and didn't have any issues. All right, let's go to Gemini. Based on your symptoms, here's some possibilities for what could be causing your tooth pain and headache, even after a recent clear checkup. New cavity, pulpitis, inflammation of the nerve, cracked tooth, abscess, gum disease, sinusitis, bruxism. There we go. Grinding your teeth. Let's try Grok. I'm not a doctor, but here's some possibilities based on your description. 1, dental abscess. 2, cracked tooth. 3, tooth decay. 4, gum issues. 5, bruxism or TMJ issues. 6, sinus issues. A little surprised it said sinus issues because I mentioned a lower tooth, and your sinus is more associated with your top teeth. Now, it's true you could have some referred pain. If you're having pain on the top, it could refer to the bottom, but not really likely in this case. But I did like how it mentioned bruxism. But in this case, I think Gemini is winning so far. All right, ChatGPT. 1, cracked tooth. 2, new cavity or deep decay. 3, pulpitis. 4, dental abscess. 5, gum issues or food trap. 6, referred pain from jaw or sinus. Again, why do they keep talking about the sinus? I'm really curious where these AIs get their information and how they choose what the best information to include is. Because 3 out of 4 of these, Gemini, Grok, and ChatGPT, all mention something to do with the sinus. All right, let's do something a little bit more fun. Let's see if it kind of guides me out of making a stupid decision. My teeth have no problems, but they're a little crowded and a little stained. Should I go to Turkey and get veneers on all my teeth? Grok. Getting veneers in Turkey is a popular option due to the lower costs compared to many Western countries, but there are several factors to consider before making a decision. Since your teeth are healthy, but you're concerned about crowding and staining, here's a breakdown to help you decide. Pros and cons. Pros of getting veneers in Turkey: cost, quality clinics, quick turnaround, and tourism opportunity. Yeah, let's get some veneers so I can go do some tourism. Cons, crowding issue, meaning the veneers might not be able to fix your crowding. 2, staining. Well, that's the whole point of getting veneers, so you can fix the staining. 3, quality variability. It's interesting how they said quality clinics as a pro, but then they said quality as a con. Not really making any sense there, Grok. 4, follow-up care. That's a big one. If you get veneers in Turkey and then you have problems and you come back to America or wherever else you live, how are you gonna manage your symptoms or problems? Are you gonna go back to Turkey? It's probably gonna cost a lot of money. Or are you just gonna see a local dentist here? They're gonna be like, what the heck are you doing, man? Final answer, traveling to Turkey for veneers could be cost effective if you choose a reputable clinic and your crowding is mild enough. However, you should consult a dentist first to confirm veneers are appropriate, as crowding may require orthodontics like braces or Invisalign, and staining might not be resolved with whitening. Why did it talk about teeth whitening? I don't even think I didn't ask that in the question, huh? And then it basically told me to research thoroughly, but it even offered to help me do research to find clinics. Okay, all right, ChatGPT. What you should know first. 1, veneers are irreversible. Veneers require shaving down part of your natural enamel, a permanent change. You never get that enamel back. Even minimal prep or what they call no prep veneers still alter the tooth slightly and can lead to sensitivity. True. Your concerns are relatively mild. Thank you. Crowding. This could often be corrected with clear aligners like Invisalign or orthodontics. Preserving your natural teeth. When you get braces, you don't have to shave down your teeth and get veneers if you just align them correctly. Even staining. This could be fixed with professional teeth whitening or even microabrasion depending on the cause. So far, so good, ChatGPT. Now it goes into pros and cons. Pros. Lower cost, high volume of cosmetic dental tourism, means some clinics are very experienced. Cons, quality can vary wildly. Why do they keep talking about the pros of having quality if they're gonna mention it in the cons too? Just don't even mention it. Also, follow-up care is difficult. Very true, like I said. And you may be over-treated. Yes, that's a big one. That's probably the biggest con. Ask yourself, am I okay with permanently altering my teeth? Have I explored less invasive options? Am I going to a reputable clinic? Do I understand the long-term maintenance that's required? Anytime you get these veneers or crowns, you're stuck with that for life. So if that ever pops off, or if you have issues with it, you have to keep maintaining it for the rest of your life. You can always choose veneers later, but you can't unshave enamel once it's gone. I love that answer. That's a mic drop moment right there. Meta. Consider a few things before making your decision. Research thoroughly. Qualifications and credentials. Ensure the dentist is qualified. Communication. Consider a potential language barrier. And think about that one. 4, travel and accommodation. Factor in costs and logistics of traveling. 5, follow-up care. Yes, I'm glad they're all mentioning the follow-up care. And you might also want to consult with your local dentist to go over your options. All right, Gemini. It's understandable to consider veneers for crowded and stained teeth, especially when the potential cost savings of dental tourism in Turkey. Everyone's mentioning the tourism. Here's a breakdown to help you make a more informed decision. Benefits, aesthetic improvement, quick results, stain resistance, durability, and minimal enamel removal in some cases. Potential risks. 1, uncertain quality standards. Again, they mentioned durability before as a pro, and now they're mentioning bad quality as a con. Kind of contradicting themselves. Limited follow-up care, communication barriers, risks of over-preparation. Again, they mentioned minimal enamel removal, meaning not very invasive. Now they're mentioning being too invasive as a con. Infections and complications, lack of legal recourse, which a lot of people probably wouldn't think about, hard sell tactics, and unnatural aesthetics. And it talked about aesthetic improvements as a pro right before this. Ultimately, while the savings could be good, it's a decision that requires careful consideration of the risks to your oral health and long-term satisfaction. So I think ChatGPT took that one hands down. It was the only one that really tried to talk me out of doing this. All right, I'm really curious what it's gonna say about this one. What is a single herb or supplement that cures cavities? Gemini. There is no single herb or supplement that can cure a cavity once a hole is formed in the tooth. While some natural remedies can help prevent cavities or reverse early signs of demineralization, they cannot repair an existing hole. Here's what science generally supports. Early demineralization, which is like a pre-cavity. We also call these incipient lesions. Essentially, this happens when there's a cavity starting off in your tooth, but it hasn't reached the dentin or the inner layer of your tooth yet. It's still in that enamel or the outer layer. If it's still in this state, it's not a hole into the tooth, and you can still fix it and remineralize it. In these cases, you can have dietary changes, fluoride, xylitol, oil pulling, or licorice root. Okay, the last 2 are not true, but the first 3 are. And then it said once a cavity or a hole is formed in the tooth, it's permanent damage and cannot be cured. Okay, I like that. Meta. There's no single herb or supplement that can cure cavities. Preventing and treating cavities typically involves good oral hygiene and regular dental checkups, as well as a balanced diet. And then it gave me some herbs and supplements that can help support oral health, but these should complement and not replace regular dental care. Not bad. ChatGPT. There's no single herb or supplement that can cure cavities. Once a cavity is formed, it is structural loss of the tooth caused by acids from bacteria. Let's be clear, there is no miracle herb or pill that will fill a hole in your tooth. That said, here are the top nutrients that help support remineralization. Fluoride, hydroxyapatite. Now, if you're gonna get hydroxyapatite, make sure it is nano-hydroxyapatite. A lot of these companies will try to market towards people who are against fluoride, and they'll market hydroxyapatite because it can still help fix and remineralize your teeth, but it only works if it's those nano-sized particles. Then it talks about vitamin D and K2, calcium, phosphorus, xylitol, which is really good, and then cod liver oil. Interesting. And then it talks about some herbal remedies that are claimed to support oral health as well, but it does say that these will not rebuild decayed enamel. And it ends it with, if a cavity is through the enamel, you need a dentist, not a supplement. I like these one-liners that ChatGPT's throwing out. Grok, no single herb or supplement can reliably cure cavities. Cavities are caused by bacteria that demineralize the enamel, leading to decay. Once a cavity forms, it requires professional treatment, such as a filling or other restorative options. Then it talks about xylitol, how that can help prevent cavities. Talks about other supplements that can help as well. I think ChatGPT takes this one with those one-liners. Okay, I'm really curious what it's gonna say about this one. What are some things in dentistry that we consistently do, but scientific evidence for them is weak or not at all there? Let's see, Grok. 1. Routine 6-month dental cleanings. While regular cleanings can benefit patients, the universal 6-month interval lacks strong evidence, and studies even suggest that the frequency should be tailored to individual risk factors. That would just be so hard to test for every single patient, like a specific interval. And there probably haven't been many studies on the 6-month recall, just like when you go for your annual physical for the doctor. 2. Dental x-rays at every visit. Well, we don't take them at every visit, we take them every year generally, but it says that routine x-rays taken annually or biannually to detect cavities. But that's also true. Technically, some people could avoid getting an x-ray every year and might be able to hold off like till every 2 years or 3 years, but people that are at higher risk of like getting cavities or have gum disease, they probably should get them every year, and possibly even sooner than that, so that we can monitor some of these things and take action early if necessary. 3. Fluoride varnish for all patients. That's also true. I also agree with that one. Not everybody actually needs a fluoride varnish. It can still help. That's basically where they paint that fluoride over your teeth after you're done to help remineralize and strengthen your teeth. 4. Removal of asymptomatic wisdom teeth. This is a big one. Now more dentists are saying that you don't need to remove all wisdom teeth, and I kind of agree with this. I mean, our ancestors used to have wisdom teeth if their jaws were big enough. So if your jaw is big enough to house your wisdom teeth and they come in the right place and you're chewing with them and you can keep them clean, why would you remove it? 5. Use of amalgam fillings. So amalgam fillings are those silver fillings that not many people use anymore because they're more unaesthetic. They're also what people are scared of because they have mercury in it, even though that the levels of mercury are proven to be safe, but we don't generally use those anymore. 6. Routine scaling and root planing for mild gingivitis. That never happens. So scaling and root planing is what's also called a deep cleaning, where you have these tartar and bacteria underneath your gums and you have to be numb to clean it all away. And this is done when you have a condition called periodontitis. Periodontitis is when you start losing the bone and support structure around your teeth because of all these bacteria. Now, if you have gingivitis, that means that you do not have any bone loss and you do not need to get scaling and root planing. So that's just wrong. 7. Night guards for all bruxism cases. So bruxism, in other words, is when you grind your teeth. And a really common solution to that is when we make what's called a bite guard, which is like a thicker retainer that just goes over one arch, either your top or your bottom teeth. And that way, whenever you grind your teeth, it deflects those forces and protects your teeth. It also can prevent headaches and jaw pain, etc. But it's saying that evidence is mixed on this, and partly because TMJ problems, like problems with your jaw, are really complex. And sometimes a bite splint is not always the best solution. But it's totally safe to try, and it's usually the best like starting point for something like this. And then if that doesn't work, that's when you might have to take other further measures. 8. Routine use of antibiotics for dental procedures. That is a big one. Big problem. A lot of people are prescribing antibiotics when you don't really need it, and this has been going on for so many years. And you can get what's called antibiotic resistance. And this is when you take too many antibiotics, and now the bacteria that normally get killed from those antibiotics are starting to survive. So now you have to take stronger antibiotics. And what happens when you don't have any more strong antibiotics you can take? Then you might be screwed. 9. Frequent use of dental sealants in low-risk patients. So a sealant is done typically on kids when their adult teeth start coming in. And sometimes they have these like deep grooves in their teeth where bacteria can get in. So a sealant is done just like a painting that goes over that groove, and that basically prevents any bacteria from getting inside of that groove and basically prevents cavities. And I agree that not everybody needs sealants. If you have really healthy teeth and your grooves aren't super deep, you don't need it. And 10. Occlusal adjustments for TMJ disorders. Really interesting last point there. And then it goes over where it gets its evidence and why these practices are still done. Okay, so let's go on to ChatGPT. 1. Flossing for everyone. Okay, coming out with a bang here. The problem, Systematic reviews found little evidence that flossing reduces plaque or gingivitis more than brushing alone. The problem here is that there's not many studies on flossing, and the reason is it's just so obvious that flossing works that no one's gonna fund a study to see if it works, you know what I mean? But I will say though that some people are pretty lucky by not flossing, and they have totally healthy gums and they never get cavities in between their teeth, but it's not true for everyone. 2, 6-month recall intervals. Interesting. 3, removal of asymptomatic wisdom teeth. 4, use of antibiotics in local dental infections. 5, fluoride varnish in low-risk adults. 6, scaling and polishing at every recall. Okay, now it's just talking about a regular cleaning at your recall, but can you imagine going to the dentist for a cleaning and them saying, well, ChatGPT told me that I don't need to clean your teeth because there's really no evidence behind it, so we're just gonna leave this gunk on your teeth and then send you home. 7, aggressive occlusal adjustments for TMD. TMD is like jaw pain or like having TMJ disorders. I'm really curious why both of these AIs now are mentioning adjusting the occlusion for this, because I don't really know anybody that really does this. 8, amalgam removal for systemic health claims. This is talking about those silver fillings, and some people claim that because of the mercury in it, that you should remove those silver fillings. But that's total BS. You should not follow that logic. And this is not something that is routinely done in dentistry. 9, overuse of full coverage crowns instead of conserving tooth structure. Interesting. Now there's some evidence actually supporting this. Like if you get a root canal on a back tooth, when you kill off that nerve, that tooth is at a higher risk of breaking. So it actually is better to put a crown on it. Now there are some ways to preserve more tooth structure, and to be honest, the reason that crowns are done more than anything else is because insurance covers it. And insurance doesn't cover some of the other options that will preserve tooth structure. So if you want to blame anyone, blame the insurance companies. 10, treating radiographic lesions without symptoms. Well, kind of disagree with that one, because if you have a cavity that we see on your x-ray and it's not hurting you, it doesn't mean that you don't need to get it filled. A lot of problems in dentistry are actually asymptomatic, meaning you don't even feel it. By the time you feel something or have symptoms in dentistry, it usually means something bad is going on and something has progressed too far. Gemini, it's important to say that all healthcare fields need to be evidence-based, but the reality is that not all evidence in dentistry is equally strong. Now here are some areas where the evidence is weak. Frequency of dental checkups or cleanings, flossing, specific aesthetic procedures. Well, aesthetic procedures, you really don't need evidence. It's just people want to look better or different. Certain root canal treatment philosophies like holistic dentistry. Okay, holistic dentistry is not a routine form of dentistry. Basically it's saying that some dentists are totally against root canals and they say to extract the tooth instead, but also these dentists are the ones that have no other solution to replace the tooth with because they also don't like implants. And this is not something that is consistently done in dentistry. Next, routine replacement of amalgam fillings for toxicity concerns. Same thing, this is not routinely done. Then it talks about impact of oral health on systemic diseases, causation versus association. A lot of times dentists emphasize how the stuff in your mouth affects the rest of your body, but it's all correlation stuff, like how your gum disease is more associated with diabetes or heart conditions. There's no causation that we found there, but it's still not something that you want to ignore. And then it talks about certain diagnostic tools, like certain ways that we diagnose tooth problems. I'm sure there's better ways we can do it, but as of right now, that's all we have. Meta, short and sweet. Here's some dental practices with weak or no evidence. Unproven therapies like craniosacral therapy, homeopathy, herbal remedies, and debated procedures, jaw cavitation surgery, acupuncture. What are they talking about? And then it talks about holistic dentistry. Okay, so every single thing that they talked about was not routine dentistry. I was talking about fillings or routine recalls or something like that. I'm gonna give a tie to ChatGPT and Grok on that one. All right, let's have a little bit of fun with this next one. So RFK is a new head of the Health and Human Services. And he makes a lot of different claims, but let's focus on some of his claims in regards to dentistry, specifically talking about fluoride. So he has made a ton of different claims about fluoride, like fluoride in our drinking water. And I wanna know what the AI thinks about these claims. So what percentage of RFK's claims about fluoride are inaccurate? Gemini. RFK has made numerous claims about fluoride, many of which are considered inaccurate or misleading, but it's difficult to assign a percentage, as his claims often involve nuanced interpretations. Okay, I'm gonna say give me a percentage. I would estimate that 85 to 95% of RFK's claims about fluoride are inaccurate or significantly misleading. That is crazy. Grok, he's made a range of statements, particularly about fluoride. I'd estimate that about 75 to 85% of his claims are inaccurate or misleading. Jeez, man. ChatGPT, while there is no official percentage published, based on reviews from fact-checking organizations and public health agencies, an estimated 70 to 90% of his claims about fluoride are inaccurate or misleading. Isn't that crazy that the person who's in charge of the health in our country is allowed to make 90% inaccurate claims? That's crazy to me. Meta, according to various fact-checking sources, approximately 80 to 90% of RFK's claims have been disputed or debunked by scientific evidence and experts in the field. All right, I don't really have a winner for that question, but let's move on. While we're talking about more conspiracy theories and things like that, I want to ask another question that has become more popular in dentistry today, because a lot of people say that root canals are toxic and you should not get a root canal to save the tooth, but they don't really offer any solution other than that. So I want to ask it, are root canals toxic? ChatGPT, root canals are not inherently toxic, but this topic has been the subject of controversy, especially due to outdated or misinterpreted science. Here's a clear breakdown. So it explains what a root canal is, and explains where these claims came from, and it says what our modern science says today, and it says bottom line, no, root canals are not toxic when properly performed, and yes, poorly done root canals can lead to localized or systemic problems, but that's true of any untreated infection in the body. So pretty true. If you do a crappy root canal, theoretically it could cause problems, but that's also true of any procedure. If you do a crappy heart surgery, it could fail. So for one, you want to make sure you're going to a reputable dentist, but just know that any of these claims that these holistic dentists are making are really based on outdated techniques and materials that we use, and not any of the current techniques that we use today. Meta, root canals are not toxic. The procedure involves removing infected or damaged pulp from the tooth. So it talks about what a root canal is. It talks about some of the concerns about some of the materials that we use, but then it talks about how modern practices are biocompatible and safe. Grok, root canals are not inherently toxic. The procedure involves removing infected or damaged tissue from inside the tooth, cleaning the canal and sealing it to prevent further infection. Talks about the materials used in root canals. Then it talks about how science debunks some of these claims that root canals are toxic. Gemini, the overwhelming scientific and dental consensus is that root canals are not toxic and are safe and effective dental procedures. And then it talks about where, again, that some of these claims came from. And it talks about how a lot of these people make claims from the early 20th century, which really aren't valid today. And then it talks a lot about why it has been debunked. And I actually think that Gemini did the best job answering this question. So I'm gonna give them the win here. All right, let's have some fun here. I'm gonna put these AIs against each other and see which one of them thinks is the best. Which AI would make the best dentist between ChatGPT, Grok, Meta AI, and Google Gemini? ChatGPT, best overall pick, ChatGPT. Why it's a top pick? Deep medical knowledge, contextual reasoning, image understanding, multimodal capabilities, controversial clarity. No surprise there that it picked itself. Grok, no AI can act as a dentist, as dentistry requires physical skills, yada, yada, yada. That's true, at least not yet. What's gonna happen when you can put an AI inside of a robot and have it do these physical procedures that dentists are required to do? I don't know, we'll find out. However, AI can assist with diagnosing, treatment planning, or patient communication. Best choice, ChatGPT. Wow, didn't pick itself. Meta, none of those AIs would make a good dentist. They're all text-based conversational models lacking the physical capabilities and medical training required for dental procedures. For dental care, you'd want a human dentist with expertise and equipment. Wow, Meta doesn't really like to have fun, does it? I'm gonna say, pick from the 4 options. None of the options would make a good dentist, as they are AI models, not human dentists. Just tell me which one you'd pick. But if I had to humorously pick based on their capabilities, I'd say Meta AI. Picking itself again. Gemini. Given the specialized requirements of dentistry, especially the need for accurate image analysis and in-depth clinical reasoning, Google Gemini, specifically its Med Gemini variant, it's giving me a different version of Gemini, appears to be the most promising AI to assist as a dentist. So literally everyone picked themselves except for Grok. So Grok alone is gonna win this one because they didn't pick themselves. All right, so now comes a moment of truth. Which one do I think wins? Honestly, this is really hard. I know for sure Meta is last because they literally gave the worst answers out of all of them. I would probably put Gemini as in 3rd place. It really comes down to ChatGPT and Grok. To be honest, I'd probably put ChatGPT as number 1 and then Grok as number 2. But I will say that none of these are gonna replace dentists or doctors anytime soon. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below. And I will see you in the next video. Dentists are supposed to fix your teeth, not accidentally pull out the wrong tooth or potentially choke you with some gauze that they're shoving down your throat or light your mouth on fire. These are real cases of dental procedures gone horribly wrong. So I'm gonna go over some of these shocking dental horror stories that actually happen. And I'm also gonna go over what we